Namaste. I am Dr. Arun Tiwari, Consultant Rheumatologist, Apollo Adlux Hospital, Kochi. In this video, we are going to discuss fibromyalgia. In context of what is fibromyalgia, to whom it affects, what are common symptoms of fibromyalgia, and how do we treat fibromyalgia patients. In the end of the video, I will be giving few tips to manage the fibromyalgia patients as well. So let's start. What is fibromyalgia? Fibromyalgia is a type of pain disorder in which patients usually perceive generalized pain and tenderness. Tenderness means when you touch the body part, you feel severe pain at that part. So most of these patients complain of generalized body pain. Fibromyalgia affects women more than men. Most of these ladies complain of pain in the arms, pain in the shoulders, blouse tightening, and generalized body pain involving full of the body or half of the body parts. Patients with other rheumatological diseases like rheumatoid arthritis, systemic lupus erythematosus, or any form of arthritis are more prone to develop fibromyalgia secondary to their primary autoimmune rheumatological diseases. Fibromyalgia is not an autoimmune disease. Fibromyalgia is a disease in which your all blood investigations can be normal, but the suffering is immense. The patient is suffering very enormous pain all over the day in all the activities, and it is not limited to pain. Fibromyalgia is very much beyond pain. It affects your sleep. Your fibromyalgia patients feel difficult to sleep. They feel difficult to get up in the morning, and the sleep is not fresh, giving you freshness. Your sleeps are not refreshing. Fibromyalgia causes fatigue. It causes poor concentration and poor performance in your workplaces. Symptoms of fibromyalgia are not limited to the pain all over the body. Patients of fibromyalgia complain very severe fatigue, poor concentration in the work, whatever they are doing, and a very poor quality of sleep. Blood tests and X-rays are usually within normal limits in all fibromyalgia patients, and they are told by many doctors as well that all tests are normal. There is no disease in your blood investigation, there is no disease in your X-ray, but the suffering is enormous. The patient perceives a very severe kind of pain which increases with the daily activity, and by evening the patient is very much in the pain, suffering through it. Also, they suffer with mood disturbance at times. Fibromyalgia is a diagnosis of exclusion. We have to exclude all other autoimmune rheumatic diseases when we diagnose a patient of fibromyalgia, because all of these diseases have very different type of treatment. Fibromyalgia is not an autoimmune disease, as I told to you earlier in this video, but there is very definite and very good quality treatment available for the fibromyalgia patients. There are three main domains of the fibromyalgia treatment. The two domain lies in the lifestyle modification. First is the sleep hygiene. The fibromyalgia patient should sleep at right time, exact time in the night, and they should get up in the same time daily, so that there is a routine. Then second is to do a daily exercise at least for half an hour daily. The daily exercise could be just brisk walking. We are not asking for any very severe forms of exercises or aerobic or weightlifting. Just brisk walking can help a lot in the fibromyalgia patients, but it has to be done on a regular basis. Yoga is very important. Yoga and stretching exercises help to ease the pain in the stiff muscles of fibromyalgia. Painkillers, NSAIDs and tramadol, these things are not useful in fibromyalgia patients, and we see that a lot of patients who have taken a lot of painkillers just because of the fibromyalgia pain all over the body, but sorry, these are not the treatment which we offer. The approved medicine for fibromyalgia are duloxetine, pregabalin or milnacipran. These three medicines we commonly use to treat the fibromyalgia patients. A healthy lifestyle along with these medicines can help to improve fibromyalgia patients to a larger extent. These patients require quite a long treatment. The treatment usually lasts for 6 to 7 months, and it might last longer as well. To combat the stress, cognitive behavioral therapies and stress combating mechanisms suggested by clinical psychologists can also help. This is not a disease which is autoimmune. This is also not a disease which is a primary psychiatric illness, then why fibromyalgia happens in few patients? Nowadays, with the understanding of fibromyalgia, what we know about it is that fibromyalgia patients have low threshold for sensing the pain. So they feel non-painful stimuli also as painful. For an example, if you touch me here, I won't feel the pain, but you touch the fibromyalgia patient in the arm, he or she will pain, because their pain perception is altered at the central level. So it is a mind-body connection which is altered in fibromyalgia. At Apollo Adlux Hospital, in rheumatology department, we provide an integrated approach and treatment to the fibromyalgia patients. Thank you.